how do you define the migraine headache, and how does it differ from, let's say, a tension headache? Or are there any differences, such as migraine, tension headache, sinus headache? How do you define specifically the migraine, and do they differ from the other two that I just mentioned?
That's an excellent question. So they do differ, but sometimes, as with everything, every individual feels a little bit different. The lines can become more blurry. But the typical migraine would be one-sided. That's very, very frequent. So the one side of the head is affected, at least in the initial phases. So it's unilateral. It's pulsating or throbbing, and moderate to severe in severity. And it always comes with associated neurological symptoms. So movement has to make it worse. Tension type headache, people will tell you go for a walk, drink some water, go to sleep. Migraine, you will wake up from it. There's no way you can go to sleep with a migraine unless you take very strong medication, right? Movement makes it worse, not better. And then you have other associated symptoms, such as light makes it worse. So your noise makes it worse. So you have smell makes it worse. So phonophobia, osmophobia, and then you have nausea or even throwing up. So sickness that comes with it as well. And in some people, a third of patients, you have this so-called aura phase preceding the headache phase where it hurts. And that's a period of sensory disturbances that can go from flickering lights to blackening of the visual field, all the way to numbness of parts of the body. Depending on where a so-called wave of electricity travels over the cortex, you get these sensory disturbances, and they go half an hour to an hour before the headache phase. Now, there are two other phases that come with a migraine. There's the premonitory phase, which is basically just before the aura, which is a period where you can, as an experienced migraine patient, feel the migraine coming, and you get yawning, you get increased thirst, you get irritability, tiredness. Some people get energy bursts. You have more urination, for example. You have cravings for food, for sweet and fatty foods. You may have lightheadedness already. And then there's the post-strong phase, which is after the pain phase has faded, which feels like a hangover or like an illness, where you have this fogginess, heaviness, tiredness, and it kind of feels like you're very drained of energy.